Blog Talk Radio.
Welcome. This is Andy Marino. We have with us today Dr. Daniel Perlman. Dr. Perlman, MD, MBA, is a practicing infectious disease specialist in Colorado. He graduated from the University of Maryland School of Medicine. He completed his residency in internal medicine at Johns Hopkins University School of Medicine and his fellowship in infectious disease at the University of Maryland School of Medicine. His fellowship also at the University of Colorado Health Sciences Center. Dr. Perlman is a member of the Infectious Disease Society of America, the Colorado Medical Society, and the International Association of Physicians in AIDS Care. He is board certified by the American Board of Internal Medicine in the subspecialty of infectious diseases. Dr. Daniel Perlman is our guest today. Dr. Perlman.
Thank you. I'm glad to be on the show.
Welcome. I'd like to, if you have a minute, just to chat a little bit about your introduction. Tell us about yourself and your practice.
Well, I have a infectious disease practice with a number of doctors who practice infectious diseases in Denver, Colorado at several hospitals. We take care of sick folks who come in often through the emergency department. They might be admitted to the ICU. We also are involved in infection control, which is the part which involves isolation of patients for contagious diseases in the hospital. So we might recommend that a patient be in a room that's a single room, and isolation such as gloving and gowns is required to visit that patient. So we also take care of a variety of different diseases, from mild disease to very severe disease.
Wonderful. Can you explain to us your practice in treatment of patients that have been involved in foodborne bacterial pathogens?
Well, basically there's a lot of standards for the practice of medicine, and these are called evidence-based medicine. And these standards have different background in terms of the amount of evidence that is positive and negative for taking care of any particular disease. But most of the time, when a patient arrives at the hospital, they haven't been diagnosed yet with a particular bacteria, and so we don't know what we're treating, and we have to use broad-spectrum antibiotics. So we'll give a patient who's very sick, for instance, 3 or 4 different antibiotics while we await the return of the specimens from the microbiology lab, where we hope to get information about what kind of bacteria or virus is isolated. And sometimes that process can be prolonged for several days.
Wonderful. Now, in your experience and your practice in Colorado, what has been your practice experience with the recent Listeria outbreak in the state?
Well, basically, we've had a barrage of questions to me and to my partners in relation to the Listeria outbreak. This is an outbreak that started in Colorado. It's been isolated to Jensen Farms, which is in a small town called Holly, Colorado, which is actually near Rocky Ford. The cantaloupes are famous and often get labeled Rocky Ford melons. And there's various different labeling for these melons. Some of them are labeled La Frontera. Some of them are labeled Jensen Farms. Some of the cantaloupes have been sold to processors that have cut up the cantaloupes and put them in their own labeling system, so it's hard to identify where the original cantaloupe came from. So in terms of taking care of the patients, they will present to the emergency room and be admitted to the hospital. I can tell you about some of the patients, particularly if you're interested.
Yes, without giving away any particular information about them. Just their case study.
No, I wouldn't disclose any confidentiality on the part of the patient. But in reference to the type of symptoms, normally the Listeria bacteria, it causes a bacteremia, which is blood-borne bacteria. And so the blood cultures that might be taken will turn positive in a day or two, usually for this bacteria. The people that are getting sick from the cantaloupe are generally elderly or immunosuppressed in some way. So if they're taking steroids, I haven't personally seen any AIDS patients with Listeria infection, but this would be another risk factor. Any person who has cancer, their immune system would be somewhat depressed or suppressed, and so these are the types of patients that we see, or patients that have a long laundry list of complicating factors. The patient that I recently saw actually had meningitis, and basically this patient had congestive heart failure, chronic obstructive pulmonary disease, and was also immunosuppressed with rheumatoid arthritis chronically. So there were a number of what we call comorbidities present. So this is the kind of patient population that is mostly involved. I'd like to mention one other factor, that between the time that you eat the cantaloupe that is contaminated with the Listeria bacteria, there can be a long delay while the bacteria are incubating. It's called the incubation period before you become ill. You may feel tired. You might have some fevers. You might have some achiness. You might feel flu-like in the initial stages of the illness, and it may take as long as 2 months or more. So we have seen, looking at this epidemic, the curve of the epidemic is still going up. There's been approximately 21 deaths that the CDC in Atlanta has related to the cantaloupes. I think 25 states have seen illness approximately from this outbreak, and 21 deaths. We expect to see more illness and deaths in the coming weeks because of that long incubation period.
Now, Dr. Perlman, you mentioned the specific categories of persons that are particularly liable to this or susceptible to these pathogens. What are the likelihoods of young children also falling victim to these pathogens?
Well, personally, I haven't seen or heard about any young children. Listeria in general could cause a problem in very young children, and pregnant women are also at risk. Personally, I haven't seen any cases in relation to that area, but certainly if you were pregnant and you started having some fevers and achiness and you were becoming ill, you would want to seek medical care, especially if you had a consideration of eating cantaloupe. So those are risk factors certainly that need to be mentioned as part of this discussion. Most of the patients, according to the latest report from the CDC, the median age of this outbreak in people is around 77 years old. So it's mostly affecting older people with many medical issues.
What is your general experience with foodborne pathogens? Is there something the consumer themselves can do to protect themselves?
Well, that's a very good question. You know, it's very difficult as a consumer to understand where the food comes from. And when you're entering a grocery store or supermarket, there is going to be food there from around the globe. And because of the globalization of the distribution chain for foodstuffs, you might find vegetables and fruits from Chile right next to some vegetables and fruits that were grown within several miles of the store that you're in. And you can't usually differentiate as a consumer. Most consumers are quite, in a hurry to pick up their groceries and don't have time to read the labels and to do the kind of detective work you might need to try to protect yourself. We do know that imported foods may have some increased risk because the FDA has higher standards for foods that are found and grown in the United States, and the ones that are imported, it's more difficult for them to maintain high standards in other countries. So if there's been outbreaks associated with Mexican cheese, there's been outbreaks with raspberries from Chile, there's been a number of imported food issues. I would like to say, though, that I think the FDA is trying to cope and change some of these practices, and unfortunately the government is in a huge deficit situation currently, and there's really not enough funding to do the adequate testing because of the globalization of the food chain. And you can't always tell where your food comes from and what types of testing it's been subjected to.
Fascinating analysis, Dr. Perlman. What would be your recommendation if you could gather all the food producers in one room? What would you suggest to them to assist you as a physician in your treatment of your patients?
Well, there's a lot of foodborne illness in the United States today, and basically this isn't just Listeria. This is a huge Listeria outbreak that we're in the middle of right now. There's been some others that have been approximately this big, but not since 1998. We've never seen Listeria outbreaks associated with cantaloupe. If I had those people in a room, I would have to tell them that a lot more work needs to be done in the food chain to understand the best way to test all the foodstuffs. And more money and resources needs to go into this area, certainly. There's a controversy currently in the cantaloupe industry whether or not cantaloupe should be washed before it reaches you at the table. And frankly, this isn't settled in any ways or means, in my opinion, because there are people that produce cantaloupes in high country or dry environments where the cantaloupe is just picked and then it's put into cartons, put into shipping containers, and then sent to the grocery stores. So that cantaloupe is never washed. The people that produce the dry cantaloupe that's not washed, it's the same exact fruit as the cantaloupe that is grown in a wet, muddy environment, and these cantaloupe from the wet, muddy environment are put into tanks where they are washed. And this is Jensen Farms was the cantaloupe with the Listeria was subjected to a processing such as this in Granada, Colorado, another town where their cantaloupe were washed in a tank and then supposedly rinsed off and then were put into the shipping chain. So what's optimal here? How do we deal with this? Should all fruits and vegetables be washed, and how do we monitor that wash water and so on? There's still a lot of work to be done in this area.
Wonderful. Excellent advice. Dr. Perlman, we understand that you are involved in many other business opportunities. Can you discuss some of those and how they relate to your practice? Well, as an infectious disease doctor, I became aware of what I would call unmet needs in this industry. And the fact that patients enter the hospital and are treated with a variety of antibiotics and sometimes causing side effects and diseases such as C. diff or Clostridium difficile, which is basically the antibiotics wipe out the normal bowel bacteria, and so then you get a toxin-producing bacteria that grows in your bowels, and this can actually be very
difficult disease to manage with some fatalities. So what we're doing is treating patients in an indiscriminate way with a lot of antibiotics, some of which are unnecessary. If we were able to diagnose people in a more rapid and accurate way, this would be a huge help to the doctors. And one of the things I'm doing is trying to advance the industry in diagnostics. That it's not just in infectious diseases either. I'm working in other diagnostic realms. There's around cardiac problems. If you come to the emergency room and you have chest pain, sometimes your EKG, the electrocardiogram, doesn't show that you have any ischemia or damage to your heart, and then they run a blood test called a troponin test. And sometimes that test does not disclose whether or not you are, in fact, having a heart attack in layman's terms. So I'm working on some more specific and sensitive ways to determine what to do with those types of patients, because a lot of patients get admitted to the hospital or sent home who fall into different categories that we can't differentiate adequately currently. And then I've got a couple of other business ideas that I'm pursuing too, alongside these other diagnostics that I just mentioned.
Wonderful. Dr. Perlman, can you again refer back to the issues that consumers face in the preparation of their food to prevent the impacts on their health with foodborne bacterial pathogens?
Well, certainly doing a thorough inspection of your food when you're preparing it in your kitchen is critical. If you think that something smells bad or looks spoiled, by all means, this should be disposed of properly and not, you don't want to eat that kind of thing and take a chance if there's any suspicion. And then in relation to the cantaloupe, possibly, but this hasn't been proven by any scientific studies, possibly washing the outside with a brush and a water solution. There's lots of preparation type materials that can be used for fruit washes, and then using a clean knife and preparing the food properly, because it's suspected in this cantaloupe outbreak that the knife would introduce the Listeria from the outer part, the rind of the cantaloupe, into the fruit section as you're cutting it. So if you wash off the outside adequately, this should be sufficient. There's not really any evidence that the Listeria is inside the fruit, embedded inside the cantaloupe. It's on the outside. So I think that's some advice in relation to cantaloupe, but that can go along with other fruits and vegetables as well.
So you recommend a thorough washing and the handling of the utensils, as well as the visual and olfactory type examinations prior to consumption. Is that correct?
Correct.
You know, Dr. Perlman, as we've been talking about foodborne pathogens, and there's a new Food Safety Modernization Act that the federal government has been mandating as a result of legislative enactment. Do you think that that will have a net effect on your practice of reducing these incidences or outbreaks of foodborne pathogens?
Well, that law is a new law, and we really don't know yet if it's going to be funded adequately to make a difference. But I think that it could make a difference if it has adequate funds. One of the areas is in relation to the food chain. If food is tested at the processing plants, whether it be a meat plant or a vegetable preparation plant or so on, if there's adequate testing, this should reduce the amount of foodborne illness that we're seeing across the board, yes. So I would agree with your statement, but only time will tell whether the new technologies are adopted and are adequately funded and our government functions adequately in this area.
Well, Dr. Perlman, in the last few minutes that remain, I have a general question. Is there a significant difference between a Listeria contamination in the human body, a Salmonella contamination, or an E. coli incident? Is there any way a consumer can tell the difference?
Well, most bacteria cause specific symptomatology. So Listeria, as I mentioned in the beginning part of the interview, it involves immunocompromised host, elderly host, pregnant females, and so on. And it produces a systemic illness. That means it causes fever, muscle aches, flu-like syndromes or symptoms. In terms of Salmonella and E. coli, these usually cause other types of symptoms. Salmonella causes more GI problems, intestinal cramping and diarrhea, which you may see some diarrhea with Listeria. Also, E. coli will be a much more rapid illness. In other words, after you ingest the food, you're going to get sick quickly, whereas Listeria, I mentioned it can take over 2 months. So every type of bacteria has a particular way that it causes disease. And there's other ones that are very well known that people have heard of as well, causing outbreaks, such as Campylobacter. That's one of the bacteria that I've written some articles on previously and has caused some big outbreaks in the United States.
Very good, Dr. Perlman. We appreciate your time. In the last 2 minutes that remain, I was wondering if you could let the audience of primarily food producers who are interested in outbreaks and recalls, let them know what you can provide them as far as advice or expert testimony.
Well, I'm not really in the business of going to court and expert testimony, but I'm glad to be available to talk to people if they have an issue around a foodborne illness or an epidemic. Certainly, I'm taking care of occasionally patients who are quite ill related to foodborne illness. I have testified a little bit over the last 20 years in relation to foodborne illness, and in fact, one was a restaurant that was causing some foodborne problems, and it was an E. coli outbreak. But that's not the main thing that I do. So I think people can always contact you, and you can refer them to me if you think it's appropriate as well, too.
Thank you very much, Dr. Perlman, for your time. I'd like to terminate the interview at this time and invite you back at the end, hopefully at the close of this Listeria outbreak, so we can recap our experience there in Colorado.
Okay, well, thank you.
Thank you very much, and I'll now conclude this interview. Thank you very much. Bye now.